Hello everyone, my name is Kafui, also known as Dr Atta Jr. Today I'll be talking to you about period pains. It's something that affects most of us women, and yeah, it's something that can be very uncomfortable to talk about. It can affect us socially, like with absenteeism at work because of severe pain, but it can also be something that you just learn to live with. So with period pains, there's normal or natural period pains, and then there is abnormal period pains. So you get primary and secondary dysmenorrhea. So the term for a period pain is dysmenorrhea. Primary dysmenorrhea occurs in most people. It is pain that's caused by the cramping of the uterus. So basically, when you're approaching your period, you could start having some cramp-like pains a few days before your period actually comes out, and then for the first 2 days usually of your period, you'll have pain. And it's just basically caused by changes in the hormones that cause the uterus itself to start to squeeze while you're shedding lining. They can be very uncomfortable. Some people have such severe pains that the pain goes into their legs and they can't walk or they vomit. And yeah, it can be treated. So we'll discuss treatment of primary dysmenorrhea, and then we'll go into secondary dysmenorrhea. So how we treat period pains is with painkillers. Usually we use anti-inflammatory drugs like brufen, diclofenac, mefenamic acid. All of these decrease inflammation and therefore remove the pain. But if your period pain is being caused by something other than the hormones, then you'd have to treat that cause for the pains to go. So secondary dysmenorrhea is basically period pains caused by something other than the natural contraction of your uterus or the natural hormones. It could be stuff like fibroids, it could be cysts, it could be endometriosis. And how we would target these different things would be to treat the cause. So we don't treat the symptom anymore, we treat the cause. So if it is fibroids, we would advise removing the fibroids so that you don't have that pain anymore. So usually you wouldn't be able to tell yourself if it is primary or secondary dysmenorrhea. But there are some signs that give an indication of what it is. So usually if it's primary dysmenorrhea, it is period pains that would have started in your adolescent stage, so as a teenager, and they usually come just before your period and end usually on day 2. When you take painkillers, they usually go away. They don't persist throughout the whole period. Whereas with secondary dysmenorrhea, it's period pains that come usually later on in life, so after 25, and when you take painkillers, they help with relief a little bit, but they don't take it away. So usually to determine the cause, you'd have to have further investigations. This is not to say that if you have period pains that go away with painkillers, there is no change or fibroid or cyst that could be causing it. So with secondary dysmenorrhea, there's many things that can cause secondary dysmenorrhea. I'm just going to briefly speak about 3. So with fibroids are basically, how would I describe them? Little balls of muscle that grow within your uterus. They can be positioned in different places on the outside and the capsule within the muscle, and they can be very uncomfortable. They can be small or very, very large, to the point where they actually cause the uterus to look like it's pregnant. Fibroids, when you have fibroids, there are usually other symptoms that come with the pain, so you might have an increased flow with that. So with the management of fibroids, you can have conservative or non-conservative methods. In Botswana, what is commonly done is that if your fibroids are very large, they are surgically removed. Surgical removal involves an operation where they remove the specific fibroid or fibroids that are causing problems. If they're very severe and if you have completed your childbearing, they can advise you to remove the uterus. Conservative methods would be to use painkillers, take analgesia medication to decrease the pain that you're experiencing, but that doesn't necessarily remove the fibroid. There's also methods that are offered in other countries like uterine artery embolization, where you work with a radiographer and they specifically target the blood supply of the fibroids. I'm not sure whether it's offered in Botswana or not. So cysts are common. To simplify it, it's basically like a sac filled with water that would be found in your ovary. So if you think about how small an ovary is, it's tiny and it's very compact, and if you put something inside it, it's like holding a stone in your hand. And when you have a stone in your hand and you squeeze it, you feel pain. So cysts can be very, very painful. Usually they erupt or they pop on their own, but sometimes the pain can be so severe that they need to be drained. So this is usually done surgically, and it would be through a gynecologist. It is underdiagnosed because it's usually a diagnosis of elimination, but also to diagnose it, you have to go through a procedure called laparoscopy, where they basically make little incisions on your body, stick a camera in to look and see whether there's tissue in the different areas outside of the different areas of the womb. So endometriosis is where the lining that is usually shed during your period is found in areas outside of where it should be. So instead of it just being at the place where it sheds, it's also found in, say, your fallopian tubes or in your ovary. It can be very, very uncomfortable. It causes severe pain because it still reacts the way the lining, where it naturally is, reacts. So during your cycle, your endometrium thickens, and if you think about someone who has this lining elsewhere, it's thickening there as well. So it can be very, very, very painful. Usually, this is helped by contraceptive. So they'd put you on an oral contraceptive to reduce the pain, or they can do surgical procedures to remove the lining. So primary dysmenorrhea is not curable, but it is manageable. Secondary causes of dysmenorrhea, they can recur. So you can remove fibroids and they can come back. But if the cause is treated, usually you will be pain-free afterwards for a longer period of time. Yeah, so it's about treating the cause. So if you remove the cause for some time, you won't have that pain. But cysts reoccur, fibroids recur, yeah. So there's a common belief that if you've had a child before, your period pains decrease. What is known is that because of the enlargement of the uterus, the physiology associated with that ends up causing a decrease in the pain receptors, and then you don't feel the pain as much. But this is not true for everyone. There are people who have had children who still experience period pains afterwards. Fibroids can affect fertility, depending on where they're positioned in the womb. And cysts can affect fertility as well, because they're obviously taking up space in your ovaries. So if you have a condition called polycystic ovarian syndrome, your fertility is usually decreased. Endometriosis can also affect fertility because you can find the endometrium in the ovary itself, and then that can decrease your eggs being released because it ends up destroying the ovary. So the secondary causes of dysmenorrhea can affect fertility. As I said, period pains can be very uncomfortable. They can cause you to miss work because they can be so severe. So if you find that they are disrupting your lifestyle, you should definitely see a medical professional, because it might be primary, but it might also be secondary dysmenorrhea. What usually happens is you'll go through a trial period of using painkillers, and the best painkiller that's suited for you will be prescribed for you by whichever healthcare professional you see. And they might advise you to use it before your period starts to prevent you from getting the pains, but for some people that doesn't work. So definitely, if you feel that the pain is affecting your function, you must see a healthcare worker. Thank you so much for watching. I hope you found this informative. If you have any further questions, please see your healthcare professional. This was just a general overview of what could be causing period pain. Bye.